Okay. All right, so we're going to go ahead and get started. I have, let's see, Counselor Flynn, Counselor Bach, Braden, Campbell, and Wu. I believe as Wu is the lead sponsor, she'll probably kick off the. Yeah. All right. Good morning, everyone. I'm City Councilor Lydia Edwards. I'm the Chair of Government Operations, and it is Monday, March 29th, 2021, and we're here today for a hearing on Docket 0261, Ordinance requiring equitable COVID-19 vaccination distribution in the City of Boston, referred to the committee on January 27th. And Docket 0303, an ordinance extending paid sick leave for City of Boston employees to receive COVID-19 vaccines, referred to the committee on February 3rd. The sponsor of these dockets is Councilor Michelle Wu. In accordance with Governor Baker's March 12th executive order modifying certain requirements of the open meeting law, we are having this hearing via Zoom. We are, in order to balance the public safety as well as the ability for us to do our jobs. The public may watch this hearing via live stream at www.boston.gov/city-council-tv and on Xfinity 8, RCN 82, and Verizon 964. It will also be rebroadcasted at a later date. For public testimony, written comments may be sent to the committee email at ccc.go@boston.gov and will be made part of the record and available to all councilors. Separating the dockets very quickly, 0261 would require at least one COVID vaccination site operate in each residential zip code, and that the opening of new vaccination sites be prioritized in neighborhoods that are most impacted. The proposal requires the Health and Human Services Cabinet to coordinate with the Boston Public Health Commission, Boston area hospitals, healthcare providers, and pharmacies. Docket 0303 would amend the City of Boston Code by adding section COVID-19 vaccination paid sick leave. The Chief, Marty Martinez, will be in attendance and testifying on behalf of the administration regarding 0261, which is again the equitable distribution of vaccines. Also invited to participate regarding both dockets are the following: former Senator Diane Wilkerson, Black Boston COVID-19 Coalition Coordinator as well, Dr. Mark Lipsich, Professor of Epidemiology at Harvard School of Public Health, Dr. Cassandra Peer, Medical Director of Public Health Programs and Associate Hospital Epidemiologist at Boston Medical Center, Stan Mclaren, President and CEO of Harvard Street Neighborhood Health Center, Eva Malone, President and CEO at Massachusetts Immigrant and Refugee Advocacy Coalition. I'm going to announce my colleagues who are here, then I will turn it over to Councilor Michelle Wu. And again, my colleagues to go through very brief opening remarks. Again, we're dealing with two dockets, one about the equitable distribution of vaccines throughout the city, and the other about providing, or at least expanding paid sick leave to include vaccinations, COVID vaccinations. So as I stated, we're joined today by my colleagues, Councilor Wu, Councilor Flynn, Councilor Bach, Councilor Braden, Councilor Campbell, of course, and myself as the chair. Have I missed any of my colleagues? That being said, then I'm going to turn it over to the lead sponsor, Councilor Wu.
Thank you very much, Chair Edwards. Thank you for prioritizing this, but also making sure that we could have a comprehensive conversation with both dockets in the same space. We know that the evidence is clear, both in the what communities had been saying prior to and all throughout the vaccination rollout, as well as in the data in every way that you cut it, that Boston's Black, Brown, and communities of color are most at risk for COVID-19 to this day, and that our vaccination strategy must prioritize those who have been hardest hit by the pandemic. As of March 23rd, state data on vaccination rates shows a persistent and steep racial disparity in Boston. And we now have seen that cases, positive tests, as well as the positivity rate has been ticking up. It's important to have this conversation today to build on the conversations that the council has been having. So I want to thank and acknowledge our colleagues who had led the hearing last month in February to make sure that we were directly addressing and speaking out and convening on issues around access, around vaccine hesitancy. So thank you so much, Councilors Campbell and Arroyo. This is meant to check in and analyze the many months of data that we have at this point, as well as to prepare for being right on the verge of all adult Boston residents becoming eligible for vaccinations in just a few weeks. And so we have a foundation to work off of, and really wanted to push, of course, on the specifics of this legislation, but also use this larger moment to get feedback and guidance from our community experts, from health and medical experts, and to make sure that we're pushing this forward with clear legislation and steps. Thank you so much.
Thank you. Councillor Flynn.
Thank you. And thank you, Councillor Edwards, for chairing this important hearing. Thank you, Councillor Wu, for filing these two important dockets ordinances. I support these very strongly. It's critical that we have equitable distribution of vaccines to our residents, making sure that residents can easily access vaccines, able to get an appointment at a location, and ensuring that language access and digital equity are also part of the process as well. Hardworking city employees should also be able to easily access vaccines. I was with them over the weekend in Chinatown and the South End and South Boston. I saw police, fire, teachers, ISD. I saw parks people, public works people, and they were asking about this important ordinance. So I think it's going to help so many people. I want to say thank you to Councilor Wu, Councilor Edwards. It's critical. And we stand with our residents and we stand with our hardworking City of Boston public employees because they've always stood with us. Thank you. Thank you, Madam Chair.
Thank you. And I just wanted to note, we've also been joined by Councillor Mejia. Have there been any other councillors who's also joined? Okay. Moving on in the opening remarks, Councillor Bach.
Thank you, Madam Chair. I'll just be very brief, say glad to be having this hearing. I think that having an efficient and equitable vaccine rollout is just about the most important thing the government is trying to do right now. And we're not always succeeding. And I think anywhere where we can find ways to optimize that, make it more equitable, make it more effective as we're in the middle of it. We know that there's literally lives on the line. So happy to be here today. And thank you to the lead sponsor.
Thank you. Councillor Braden. Maybe away real quick. I'll come back to Councillor Braden. Councillor Campbell.
Thank you, Councillor Edwards, and thank you, Councillor Wu, for bringing these ordinances today before the body. Vaccination equity is critically important to me, and we do know that having a vaccination site near your home doesn't necessarily equal equitable access to the vaccine, but does require a multifaceted approach that, of course, is proactive and includes the intentional engagement and multilingual engagement in communities. And so I really am grateful to you, as well as all of the folks who are participating in today's hearing and for the work they do every day. Thank you to the medical professionals, community-based organizations, the volunteers who have been implementing this multilingual community engagement strategy over the last few months, delivering, of course, information about the vaccine, helping those make appointments, have access to the vaccine. Really grateful for their efforts, as well as for folks on this body. Looking forward to the conversation today, updates, and of course, learning more about the additional steps the city could take in strengthening our vaccination efforts, which are critically important for us reopening and, of course, protecting the health and safety of our residents. So thank you, Councillor Wu, and thank you, Councillor Edwards.
Thank you, Councillor. Apologies, Councillor Mejia.
Hi, yes, good morning, all. Thank you to the chair and to the sponsor for calling this hearing. This is incredibly important opportunity we have in order to safely and equitably distribute vaccines to residents across the city. Equitable can often be a buzzword, so we really need to use the space to create policy that actually seeks to address public health problems that continually impact communities of color, particularly our elders. So I'm really glad that we're having this conversation and we're centered in on the lives of those who are most impacted. So for those who are tuning in, that's what equity is all about. So really excited about this. Also up for discussion is an ordinance that seeks to extend paid sick leave for City of Boston employees. This is a crucial workforce development issue. And as you know, I'm the chair of workforce development, so I'm happy that we are also leaning into this. And I hope that the city can be seen as the gold standard for how to treat employees who get their COVID-19 vaccine. I also think it's really important to underscore Councilor Campbell's point about just because there's a vaccine site in our neighborhood, that doesn't necessarily mean access. I'm gonna tell you all, just over this last week or so, just having the Reggie Lewis Center doing intense outreach in certain communities to making sure that people get vaccinated. There's still so much confusion and barriers for people to sign up to even get their appointments. Some people don't have smartphones. So just a lot of stuff that we still need to unpack in terms of what this is going to look like to making sure that everybody gets vaccinated. And I don't know why everybody always wants to know which vaccine it is. Every time you talk to people, like, which one is it? Is it, you know, all these names? And I'm like, look, it's a vaccine, just get it. So I think that there is also some conversation in terms of how we educate the public about, because I guess apparently some vaccines have side effects. So I think as part of our communication and rollout, that we also need to educate people about the differences if there's a need for that, because there were a lot of folks who were afraid to even go get vaccinated because they were unclear about which vaccine they were going to get. So that's all part of the conversation, maybe for a different hearing, but I just want to throw it out there while I have the floor. Thank you, Councilor Wu, for leading in this space and for bringing this to the forefront, and Councilor Campbell and Councilor Arroyo for your early efforts as well. So thank you very much.
Thank you. So just wanted to be clear, since we have two ordinances on deck, we're going to deal with the first one, which is about the equitable distribution first. And we have Chief Marty Martinez, who has some testimony specifically about that and what the city's doing. And then from the chief, we'll go to some of our attendees who have been invited, specifically, again, talking about the equitable distribution of the vaccine. After that kind of conversation happens, I'd like to then turn it back over to the lead sponsor, and we're going to go on to the conversation specifically about the addition to COVID vaccination to our leave policy. There will be no testimony from the administration on that. We did receive a letter, however, from CFO, Chief Financial Officer, Emma Handy, of which I will kick that conversation off, and she summarizes kind of some of the leave policies of the city of Boston. All right, so turning it over to Chief Marty Martinez, if you're ready to go.
Counselor, we communicated that Chief wouldn't be available until after.
Oh, I'm so sorry. I thought the email said just the opposite. My apologies.
No.
So there is a presentation, however, in the email. Was someone from the administration going to walk through that?
So he's going to be presenting that at after 10:45. We communicated that he wasn't going to be available until 10:45.
Ah, my extreme apologies. I somehow missed that. All right, then. So why don't we just go ahead and go to the attendees, if that's okay. Councilor Wu, is that okay? We're just going to go right to the.
Yes, and I would recommend, if I may, Madam Chair, that they're kind of two groupings and two topics with attendees in terms of the sort of an update on the science and kind of where the virus is headed, with particular expertise from the healthcare community, and then an update on the community side when it comes to efforts so far in terms of accessibility and all that.
So when you say update on the science, I'm thinking we're going to folks with DR in front of their names to do that first. Let me get the doctors ready. Let me get my list. Here we go. So with that, I think that makes sense. That does set the stage a little bit better, right? So let's get an update on where we are in terms of the virus and how it's moving. Then we'll go to Senator Diane Wilkinson. that make sense? And community advocates, Eva and Stan as well. All right, so I see two on the list so far, Dr. Mark Lipsitch and Dr. Cassandra Pierre. Are you both ready?
Yes.
And I would note that Stan is here on behalf of the community health center. So
Oh, my apologies. On behalf of the community health centers. So you also, if you would like Stan to be after we can go Mark, Cassandra, then Stan. Very well. Thank you.
Okay. Thank you very much for the opportunity to speak. I'm going to give an update on the variants of the virus and their relationship to vaccines. I'm a Boston resident, and at the end, I'll make a brief comment about my own experience with vaccine appointments. The emergence of variants of a virus is something we expect and that we know happens with all viruses. Some of the variants which arise when the genetic sequence of the virus changes as it passes from person to person, some of these variants have become known as variants of concern, and they carry multiple changes shown here on the diagram of the virus genome in each of these variants of concern. Why do we care about these variants? Well, a number of them, particularly the B117 variant, sometimes known as the UK variant, are rapidly increasing among the isolates that we know about in the US. We don't have a comprehensive testing program, so there's not an ability to say exactly the number. But as you see from the orange part of this slide on the right here, this B117 variant has become much more common in recent weeks in the United States. Looking specifically at Massachusetts, we can see that there have been 441 cases as of yesterday reported. There have also been 16 and 9 cases respectively of the 2 other variants that I'll mention at the end. But I think right now the focus should really be on this first variant of concern, the UK variant or B117. What we've seen from this variant is that it can increase in frequency very quickly because it seems to be more contagious, somewhere between 50% and 100% more contagious than the other variants. And a study published in the journal Nature from the UK last week shows that over the course of time from November to January, in each region of the UK, the frequency of this variant went from almost undetectable up to nearly 100%. So it has an advantage. We're watching evolution in process, and it becomes more common. We care about that not only because it's more contagious, or mainly because it's more contagious. And that means that control measures that are effective for what we've been doing may not be as effective to contain this new form of the virus. We also have growing amounts of evidence that there is a slightly higher level of severity. The risk of death or severe consequences on infection is slightly higher, although the differences are pretty small. So the main concern is about failure of control measures or limited effectiveness of control measures. So if we in the old days, in the present time, have had to stop something like 2/3 of the transmissions that were happening by doing social distancing, masking, and other interventions, we may now have to stop something like 80 or 85% of transmissions for this new variant if it is twice as contagious. And that's just more difficult and requires more intense interventions. It's too early to say for sure, but it seems that settings that previously had low transmission risk may be at higher transmission risk with the more contagious variant. And 2 examples have occurred in the Midwest. There was an outbreak of over 100 staff and children at an Omaha, Nebraska daycare center, largely caused by B117. Daycares have not been major sites of transmission in the past. And similar story developing for a youth sports outbreak in Minnesota. What does this mean for vaccines? It just adds really to the urgency. We are in a race between vaccinating the population and having a bigger problem on our hands as B117 spreads. So B117, for example, has sped up the pace of the epidemic in many parts of the US, as I just mentioned, as well as in the UK and other countries. We have really good evidence that the vaccines are highly effective against this variant, particularly from Israel, and I should have mentioned the UK on this slide. Vaccination serves two purposes, as you know. The first is to protect those at greatest risk of severe disease. And there's emerging evidence that also vaccines will reduce transmission and thereby bolster the impact of masks and social distancing and eventually allow us to continue with reopening society. I mentioned there are these two other variants, the one that was first found in South Africa on the left here and the one that was first found in Brazil on the right. For reasons of time, I won't go into the details about them, but at the moment they are still minor in the United States. They may be somewhat more difficult to control with vaccines, but so far the evidence suggests strongly for the South African variant and more limited evidence for the Brazilian variant that vaccines will be effective, at least in preventing severe disease from these variants. And again, these are not the ones that we're quite dealing with in large numbers in the US, although they do exist. So that's the summary of those two other variants. But I think the real issue is that we are trying to speed up vaccination in order to counter the B117 variant. I will just close with an observation in response to what some of the counselors mentioned earlier. I'm a Boston resident. I'm a vaccine researcher, which is one of the groups that was prioritized in the current list that started last week. And I will say that as someone with a desk job and a flexible schedule, it took me most of a whole day scanning a Twitter bot and doing a lot of things that reflect access to digital technology and flexible time. It would not be so easy for someone who's not sitting at a desk all day. And so I think the importance of measures to make appointments available to people, not just physically close, but easy to book, is critical. And will be important, especially to enhancing equity. Thank you.
Thank you very much. We'll just turn it over now to Cassandra.
Hi, good morning. Thank you, Councilors Wu and Edwards, for sponsoring and chairing this important hearing. I'm a Hyde Park resident who's also on the state's Health Equity Task Force, so this issue is obviously very important to me. We know that COVID-19 has not turned out to be the great equalizer some people said it would be. We've seen disparities in Boston, not just in disease outcomes for communities that have been hardest hit by COVID, our Black and Brown communities, but also really disappointingly, racial disparities in treatment and now vaccination that we should largely have been able to avoid. Although there was a lot of conversation prior to the state's vaccine rollout, positioning equity as a pillar of the process, we failed right from the start by declining to rely on our existing public health infrastructure with prior experiences in striving for equitable outcomes and a knowledge of how basic social determinants of health, like transportation, have to be factored in when we engage and try to reach marginalized communities. We also failed to engage with trusted and knowledgeable community leaders and to understand that the narrative of vaccine hesitancy in communities of color was overshadowing and hiding the true story of a community that was and is eager to get vaccinated because we are at highest risk of dying from COVID-19. Since the beginning of the rollout, many things have been done to improve equitable distribution and its process, but there's so much more to do, particularly as we prepare for that broader phase of rollout that Councilor Wu alluded to, that determines whether we will achieve community immunity in our Black and Brown communities and the city as a whole or not. And stakes are high because as much as we're discussing a system to prioritize vaccine equity now, what we're really creating is a framework for what health equity in Boston could truly look like. So what we need to do immediately is to see health equity as the true foundation and litmus test of an effective vaccine distribution process at every stage of the process, at every phase of rollout. What that means is right from the start, resources have to be disproportionately directed to communities with the highest rates of infection and social vulnerabilities. Local targeted community organizations should be engaged in all aspects of vaccine delivery. We need to bring vaccines to where people are. Although many more community vaccination sites exist in Boston, and we're talking about obviously broadening out to more If we truly want to negotiate issues with access and reach structurally vulnerable populations with the highest risk of COVID, we'll need to do more. We need to expand hours and days in which we vaccinate to ensure a population of essential service workers who are more likely to be exposed to COVID but have less flexibility in scheduling time off, that actually have the ability to attend a vaccine administration site. We'll need to be able to bring vaccine directly to our communities for more than just those who are homebound, whether it's through expanding mobile outreach, vaccinating directly at essential job sites, public housing, congregate housing, group home facilities, and other places where vulnerable populations and people are present. Removing this barrier will be a crucial step in continuing the momentum we've just begun in vaccinating our Black and Brown communities. And then we need to continue to build credibility. This work must be done in partnership with local community and faith-based organizations and with community health workers to continue the work of vaccine acceptance through education and dialogue, as well as through focus on social determinants of health, the latter of which will demonstrate that the system, government, and public health are willing to invest in the issues that our own communities prioritize most deeply, all of which builds credibility and engenders trust in the vaccines and the system. We also must be realistic and realize that this is going to take some time, and we're not going to be able to engage everyone on the spectrum of vaccine deliberation right away, or even the next few weeks to months. Many of these people who are on the spectrum of vaccine deliberation have legitimate concerns about the vaccine rollout after generations of disenfranchisement and bias within the healthcare system. But we can still work to protect the health of those who are not yet ready to be vaccinated. The Stop This Right sites need to be maintained and highlighted as spaces for streamlined COVID testing. And more than that, the use of these sites should and can be expanded. Community health workers can be added to these sites to screen for social and economic needs and connect people to needed resources. It's also a place where people could be screened for the chronic health conditions that predispose to more severe complications of COVID-19 and can be connected to healthcare. Many people have been unable to address these health concerns throughout the pandemic. It is by offering these supports and resources that trust will be built and more people will become engaged in the process and eventually vaccinated. The inequitable allocation of health and social resources away from the systematically marginalized populations that need them the most, and the disparities in chronic and infectious diseases that we see as a result of this, is a generational problem, and it will continue to be a generational problem, including for the next pandemic, if we decline to take the opportunity to create and sustain a new model of healthcare, community engagement, and community health. COVID has given us an opportunity to do this, and we cannot waste it. Thank you for your time.
Thank you. Now we'll turn it over to Stan. I believe you're muted, Stan.
Good morning. Can you hear me now? My name is Stan Mclaren. I'm President, CEO of Harvard Street Neighborhood Health Center. We're located on Blue Hill Avenue in Dorchester, which is right in the heart of the city of Boston. Thank you, Boston City Councilors and Councilor Wu, for leading this initiative around vaccine equity. It is a pleasure to be here with you this morning. And it's also an honor to present before you and with this distinguished panel of colleagues. Community health centers have a long history of providing care in the United States. We came out of the civil rights movement, and by design, health centers are located in medically underserved and low-income rural and inner-city communities. Currently, in many of the Commonwealth's hotspots, health centers serve more than 1 million patients across 300 practice sites. 84% of our patients are low income, 67% are racial and ethnic minorities, 40% are best served in languages other than English, and they often face issues of unstable housing and limited transportation. For many communities across America, and especially in communities of colors, health centers represent the main access point to care. Crucial in that we have developed trust in these communities. And for years, health centers have been on the front lines addressing major health disparities. These health disparities present as medical conditions that put our patients at higher risk for COVID-19 complications and even death. From the beginning of this pandemic, health centers believed that it was paramount to respond quickly and robustly to COVID. At Harvard Street, we have served the healthcare needs of the community for over 50 years. Currently, we serve about 10,000 patients and experience a little over 30,000 patient visits each year. We are multilingual with English as a secondary language. Our patients, and many of whom are people and families from my community, have hard lives and are some of the poorest in Boston. I can personally say COVID has significantly impacted their lives. Like most community health centers, Harvard Street has been hit hard by this pandemic. Throughout this process, we have never closed our doors, from retrofitting our health center to ensure the safety of our patients and employees, to standing up testing programs, contact tracing teams, and vaccination sites. We have never slowed in delivering care. Throughout this pandemic, we continue to care for our patients, many of them with chronic conditions like diabetes and heart disease, that those diseases didn't stop because of this pandemic, so we couldn't stop delivering service. When the vaccine became available, we spent time educating our staff and community about the importance of taking the vaccine. I'm pleased to report that nearly 70% of our employees have been vaccinated. Without concerted efforts from the healthcare community, hesitancy will continue to present a problem, and I view it as a serious problem. Health centers are trusted entities in the community, and we are currently administering the vaccine at our health center. As I said, we're located on Blue Hill Ave, 632 Blue Hill Avenue. However, from the very beginning of our strategy for successful implementation, we engaged and worked with our strategic partners and community with who we have built strong, trusted relationships throughout the years. With the support and partnering of the Boston Public Health Commission, we were able to expand our mobile testing program. Their financial support enabled us to purchase a new van to expand our mobile testing throughout the city of Boston into schools, housing developments, and diverse churches. We partnered with the Masons to stand up a vaccine clinic at the Prince Hall Grand Lodge in Grove Hall. We partnered with Central Boston Elderly Service to administer the vaccine to their elder patient clients, and agreed to use their facility on Washington Street in Roxbury to provide vaccine to the public. We also reached out to community-based organizations like Children's Services of Roxbury and faith-based organizations and churches to schedule pop-up vaccination clinics with our mobile teams. As part of our community education campaign, we participated in co-sponsored town halls and partnered with other organizations like the Urban League to attend and present at neighborhood tenant associations. We've put forth representatives at these functions and meetings and events that speak various languages. Community health centers have faced various challenges like inadequate vaccine supplies and workforce shortages. However, the supply issues are starting to improve. As community health centers continue to play a significant role in the vaccine rollout in Boston, so while supply is still an issue, we're getting more and more all the time. Community health centers are stepping up and getting these shots into people's arms as quickly as possible, and as supplies are made available. However, workforce shortages are still a concern, and despite that, community health centers want to do more. In all of this, there's also been bright spots that show our frontline workers' dedication. I'd like to give you an example. Recently, we had few extra leftover doses that we typically have towards the end of the day. This time it was one of our mobile vaccine pop-ups, vaccine events. The vaccine team took it upon themselves in the rain and we were doing this vaccine pop-up site in Roxbury. They took it upon themselves to go out in the street looking for someone when we had these extra doses, because we don't believe in wasting any of the doses. And what they did was they ended up going into a barbershop. Of course, people looked at us like we were confused when they walked in. But what they did was they recognized the fact that we've been participating in vaccinations all throughout the summer. So they knew it wasn't like, like a prank or anything. We were for real, because we've been in the community doing this for quite some time. So they agreed to take the vaccine, and I am proud to say that today those patrons that attended that barbershop are ambassadors, encouraging other customers and community members to get vaccinated. So that's what happens when you're out there into the community and you're going into those hard to reach places. And this is what the mobile testing has allowed us to be able to do. This is what community testing has allowed us to be able to build that trust, not only from the standpoint that we've been at it since the beginning of this pandemic, but because we've been in the community all along. We have been in proximity to those vulnerable populations. So we are working hard, and we are also thinking about the other side of this pandemic. At Harvard Street, we have a vision. An expansion plan. Our expansion plan vision calls for building a new health center with a mixed-use facility that includes housing and retail space. And I'm saying this because I think we have to address the equity issues, even though we're looking at it from the standpoint of the pandemic. We have to not only think about vaccine distribution, but we got to think about the other side of this and how we plan to address inequities. And part of our vision as a health center is to do more than just increase access to healthcare, but to support the economic mobility and act as an economic anchor to jumpstart and revitalize our surrounding area. So counselors, how can you further support community health centers in this work? Well, you can leverage your relationships with trusted community-based organizations to help us with hesitancy, to help us with outreach, and to help us with even getting space for our vaccination sites as we go throughout the community. You can help us get into those tough neighborhoods, like some of the housing developments and challenging blocks in the city. There's certain areas it's hard to get into and no one else would, because you have friends and relationships in those areas, you have access. Help us with that access. We could use resources for technology. We've got an onslaught of people calling us right now. We can't keep up with the phone calls. It's very difficult. Typically, our folks are picking up the phone and calling us. There's the online piece, even though we have it, it really, our clients are not typically technically savvy. And finally, if I can leave you with this, the most significant contribution would be that you ensure and continue to be diligent in ensuring that the entire vaccination process is handled through an equity lens. Thank you.
Thank you so much. Really appreciate that. Very passionate and wonderful testimony, as well as direct examples of what you mean when you say go into the community. Thank you. We've been joined by Councilor at Large Michael Flaherty, and it's okay. We've also been joined by Chief Marty Martinez. So I'm going to go ahead and turn the mic over to him for the presentation, I think giving us an update overall on how the city is doing. And then we do still have some community advocates who would also come and testify. My apologies, Chief Martinez.
Good morning. Thank you, Councilor Edwards. And thank you to all the councilors who are here, Councilor Wu, Councilor Campbell, Councilor Mejia, Councilor Bach, Councilor Flaherty. I think I saw Councilor Flynn. Thank you for all having today's hearing and being able to allow us to share some information. And I was only able to hear from Stan, so thank you, Stan, for the work you are doing, that you all continue to do. It's meaningful, and we appreciate our partnership with you. So thank you, Stan. And I see Councilor Braden as well. So thank you, everyone, for being here. What I'd like to do is just very briefly share with you a couple slides that will give you some background of where we're currently at. As you know, this is we were together a couple months ago, and thought that we could share a little bit about what we're currently seeing across the board. So if I can share my screen, let's see if I can do this. Okay. Let's see here. Okay. So let me share it this way. Try to make it a little bit bigger here. Okay. So what I want to be able to do is just briefly share with you a couple pieces, and there's a lot here, but I want to be brief so you have questions and time. As a reminder, the City of Boston has a four-pronged approach of how we're creating access to the vaccine and using an equity lens to be able to do that. We use four models: mass vaccination clinics, group clinics, community-based public clinics, and then mobile sites. And all four of them are important parts of this puzzle, and all four of them are playing a role in creating equitable access to the vaccine. The mass vaccination sites, you know where they're at. Overall, we have 22 fixed vaccination sites across the city that are open to all eligible residents. You can find them at boston.gov, and they're across the mass vaccination sites, the community-based public clinics, and the mobile clinics. The priority group clinics are targeted clinics that most people won't know exist, but they're targeted clinics for specific populations. So we have at least 10 additional sites that are open to targeted residents. It can be patients of a health center or hospital, a specific subgroup, like essential workers, or a specific worker category. As you all know, we had a specific clinic in partnership with BPS for essential workers working through our public schools, and we have transitioned that into an essential worker clinic for all essential workers. And then we have various mobile efforts, which are both supported by the city and community health centers, like Stan mentioned, and the work that Whittier's doing, the work that East Boston Neighborhood Health Center is doing, and hospitals that are creating one-day access. So these are various mobile efforts. It includes our efforts by Boston EMS, who is going into our BHA housing developments to vaccinate individuals on site, in community rooms, knocking on doors, bringing people down, connecting with them to be able to do that. There's various other mobile efforts that are continuing to do that as well. We're working to create equitable access to vaccines through a variety of different efforts, which I know I've spoken about, but set aside slots, that specifically is targeting a certain number of slots at a mass vaccination site. At the Reggie Lewis site, which is about 2,000 appointments per day are available there, half of those are set aside community slots. So community organizations like the Black Boston COVID Coalition, the Greater Boston Latino Network, and a variety of other community groups are able to help book set aside slots for folks, so we can ensure folks from communities of color and in neighboring neighborhoods close to the Reggie Lewis can get access to those set aside appointments that are there. The same is true for the clinic partner we're using with Tufts in Chinatown, where we have set aside slots available there to create access for folks in the surrounding neighborhoods. We also are targeting on-site appointment processes. We have worked to create, in partnership with the state, a set-aside card appointment. So an individual can get a card, they get the time, the date of that appointment, they're able to show up at that location without having done anything online, without having filled anything out, and they can register on site. Those cards are actual dose appointments. So we work with community partners to be able to do that. For example, with essential workers becoming eligible, we worked with some of our unions representing those essential workers to be able to create access for folks, whether it's working in our grocery stores or in our emergency food preparation, being able to make sure that they could create access, knowing that the online appointment process was not going to help them to be able to do that. We've also partnered with community-centered locations and partnerships. Many of you have heard the great work of BMC and us supporting them to be able to partner, find locations, and work to create avenues to be able to do that. And of course, we're increasing access to our mobile vaccination efforts. The city looks to greatly expand that over the next 10 days with additional clinical partners and additional doses coming from the state, which has been an important part of this work. We also created boston.gov/get vaccinated. It's a site where folks can go who may have been disproportionately impacted by COVID. We're talking about folks over the age of 60 and residents of color. They can go to that site and ask for help to get an appointment. And we have a team staffed by Health and Human Services staff and folks we brought on to help us get people appointments. So they can go to that site. They can also call 617-635-5555 to get to someone who will help them figure out where can they get an appointment, what's eligible for them, and how do we make that option available. We're also focusing on barriers to access, including the locations, where these locations are, how appointments are made, arranging and working with city departments to create transportation for folks, wraparound supports that we know are needed for individuals in terms of interpretation on site, as well as outreach in folks' native language. As well as looking at hours of operation. Very important that for essential workers, we have hours of operation that speak to the fact that essential workers can't go to a clinic always from 9 to 5. So we've been partnering with organizations and we are going to start funding some of our community partners to expand their hours so that they can be able to meet the need that's there. So while we're creating equitable access, which is all those pieces, we're also trying to break down those barriers that we know exist to prevent folks from being able to get access. And then public awareness and education efforts include partnering with trusted CBOs. As many of you know, we have funded a variety of community-based coalitions, direct funding and support so that they can go out and outreach, door knock, mobilize their communities in partnerships with others. We've done dozens and dozens of community presentations with CBOs. We've done them in English, and now we're starting to do them. We've done them in Spanish. We've done Cape Verdean Creole. We're doing one in Mandarin, I think, this week, and continuing to do outreach within specific targeted populations, faith-based organizations, unions, and community groups. And starting late next week, we'll launch a public awareness campaign that's really focused on hope. And I say that because that's what we're looking for. We're looking to be hopeful for the future and hopeful post-COVID. And so you'll see a campaign that we're going to launch that's going to be connecting access to the vaccine and people getting vaccinated to getting a sense of hope and getting beyond COVID. So that public awareness and education campaign is super important to address some of the hesitancy that's there, but more importantly, to build confidence in the vaccine. And then last but not least, we've been working with clinical partners and community-based organizations on the overall strategy and planning efforts. We held a vaccine planning summit with partners last week, talk about what's working and where more support is needed and how we can ensure that the city very specifically can support our four-pronged approach and support all the organizations that are doing what they need to do. The state controls much of this process and it has oversight of this process. And so the city is not necessarily able to control where doses go. But what we are able to do is ensure that we have a coordinated approach, an approach that's going to make sure that we're addressing gaps as they come out. And also make sure that we're doing everything possible to create real access for folks, not just in theory, not just to the short term, but real access for folks. So the last thing I wanted to just be able to do was just briefly share a couple pieces of data. As you'll see, this data, which was released this morning, we have Boston specific data. You'll see we have about 31% of Bostonians over the age of 16 have received at least one dose. And that's important. That's the pathway for full vaccination. 17.8% of Bostonians have been fully vaccinated, about 103,000. These are populations based on folks over the age of 16. So that's all who's currently eligible. You'll see this data here. These are population-based rates so we can get a sense of, are we reaching folks if you compare by age? So right now, 75,100 out of 100,000 seniors over the age of 75 have been vaccinated. So if you look at that as a percentage, about 75% of seniors over 75, about 75% of seniors 65 to 74 have been vaccinated. So we've seen a large number of our older Bostonians get vaccinated, which is super important. And we have to continue to monitor that so we can see that continue to go up. We also want to show your information by race and ethnicity. We see, of course, that when we look by race and ethnicity, you're going to see that obviously the populations that we want to focus on are all residents of the city, but of course our residents of color who've been inequitably impacted, we see them currently vaccinated at a lower rate. White, the highest rate at 30,000 per 100,000. Asian, 28,000 per 30,000, Black, 26,900 out of 100,000, and Latinx, 19,616, and American Indian, Alaska Native, 18,000 out of 730. So we want to compare this by population, so it's not just pure number, so we can sort of see and compare populations. We've seen improvement in the Black African American vaccination rates, which is important. The Latin rate has still been quite low, especially when you compare by population. We do want to stress that eligibility impacts this. We have a younger Latinx population, an older white population by average. So again, we know not everyone's eligible, but we want to have a sense of comparing this by population. And then you're going to see this, like 2 more slides, and then I'll wrap. You'll see this is by race and age related to race and age by different population groups. So you'll see that, you know, in terms of 75 and older, we've actually vaccinated a higher percentage of Black seniors over the age of 75 compared to white, Asian, and Latinx. We've vaccinated a higher percentage of Asian seniors, 65 to 74, compared to the other categories as well. And then, of course, 16 to 64 is still largely not eligible at much lower rates. But again, we want to be able to dig into this. So when we're saying seniors are getting vaccinated, which seniors are getting vaccinated? This is important. We want to continue to see these rates go up and make sure that we're getting access to folks where they need it. And then last but not least is neighborhoods. You'll see that these are neighborhoods, again, population-based rates as of March 23rd. And again, I can't stress enough that the average age of population is different here. So not incredibly surprising to see West Roxbury, which has the highest percentage of seniors in any neighborhood across the city, is currently vaccinated at the highest rate in the city. There are neighborhoods that are much younger, Fenway, for example, being one of those neighborhoods that has a younger population, vaccinated at a lower rate, since most folks, obviously, younger Bostonians are currently not eligible. But again, as we start to see more people eligible, we'll start to be able to see, are there gaps in neighborhoods, right? And we want to be able to look at that today, knowing that right now, when you see East Boston, that rate has improved, but you also see Matapan, that rate needs to also improve. So you're going to see, we've seen some progress in these rates over short time. But again, it's going to be really important when we have wider spread eligibility that we're able to tackle this. We are releasing this data, and I don't know if that data was shared with counselors in advance. I will make sure you get it today if you didn't. We're releasing this data every week, Monday morning, we get the data from the state, we're able to dive into it, break it apart, figure out where those gaps might be, and then ensure that we're creating access in specific places and locations. So that's where we're at. The city is focused on, under Mayor Walsh, we've been keenly focused on our COVID response related to equity and ensuring those most disproportionately impacted could get their needs met. And now under Mayor Janey, the administration is doubling down on that and continuing that effort. And with that, I'll pass it back to you. Thanks, Constance.
Thank you, Chief. We're going to go ahead and go to Diane Wilkerson, and then we'll go to Eva Malone.
Good morning.
Good morning.
Good morning, Counselor. I want to say thank you to all of you, Madam Chair, to Counselor Wu, Counselor Campbell, all of you who have been involved in really keeping this issue on the forefront. We appreciate it. I want to stay within my 5 minutes. So what I thought I would do is to tell you what we're doing, tell you what's working, and tell you where the holes are going forward as we're approaching the April 19th date when everyone is going to be eligible. So I'm here on behalf of my name is Diane Wilkerson. I'm here on behalf of the Black Boston COVID-19 Coalition. And You know, we just marked 1 year anniversary in March. First week in March is when we got together. We had 8 members. We now have a little over 420 members, and they represent everything from elected officials to churches to clergy to business owners, residents, nonprofit organizations, doctors, you name it, young people. It's been an amazing experience. We have been involved in this from the beginning. So the tracking and tracing, the monitoring, certainly the testing, and I want to talk about that too, and the vaccination now that we're here. It's been said by Mr. Mclaren and the other speakers that at this point, I think we're all thinking about the after pandemic. What's next? What do we do? And what is this city going to look like for communities of color in particular who weren't doing very well going into the pandemic? And so we talk about it constantly. This pandemic has laid bare all of the worst, the issues. Black Boston Coalition, though, has had a unique experience, so much so that there are now some 14 states that are looking at the work of CIC Health relative to what is going on at the Reggie Lewis. And it's significant because they also operate other mass sites, but it's the Reggie Lewis that has caught the attention of Philadelphia. We were told the other day that Jamaica, countries in Europe, 14 other states are asking and calling. And we've made clear to CIC Health, the operators, that they're not calling because of CIC Health. If that was the case, they'd be asking about Gillette and the Fenway, soon to be Hines. They're calling because there's something extraordinary that's going on there. And we really credit 2 entities. One is the city of Boston, and the other is Reverend Liz Walker, who on the day that CIC Health was contracted to operate the Reggie Lewis, suggested that they be in touch with us, and they were. And as I said, I think we were able to do something extraordinary in that we laid clear to them that in order for them to operate an effective vaccine center in our community, there were going to be some things that have to happen. People would have to walk into that center and see people that look like them. And when I say that, I mean Black, Latino, Asian, because this is the community that they're supposed to be targeting. Right now, some 98, 95% of the people who roll into the Gillette, 92% at Fenway, were white residents of Massachusetts. And so the whole purpose of Reggie Lewis was supposed to be to service people of color. It goes without saying, I think Dr. Lipchick said this, and he said it in a different way, but I will tell you, is that part of the issue that we've been having across the state is that the entire state's vaccination system was created on the basis of access to be able to get online. So it doesn't work. And they've been trying to dress it up every time they edit it. I think they're on their 10th iteration of their sign-up system, and they continue to scratch their heads as to why they can't get large numbers of people of color. They also now think going to a zip code process is somehow going to make this magic. They're not going to get them because, as has been said by more than one testifiant, our communities tend not only not to have access for the populations that were initially targeted, but are not trustworthy of putting that kind of information online and sending it off. And so what we did, we created our own system where we do just the opposite of what the state does. And that is we call people. We called them. We are out on the ground. We actually have flyers all over the place. It's funny, we ran into Councilor Flynn. We have photos of him in Chinatown. We were putting up flyers to CIC. And so you're in our picture, Councilor Flynn, that we will have on the website. You'll see them. All of our flyers are done in 9 different languages. We work with CIC on this. We hired local residents to translate the information and had CIC pay them. And so we have it in Somali and Arabic, in Cape Verde, and Haitian Creole, and Spanish, Vietnamese, and Chinese. And we've been doing targeted information and lit drops for the last 3 or 4 weeks. I also think that Chief Martinez testified about the process, or the ticket process. We started a pilot with CIC now 3 weeks ago, which culminated in this past week. We had an opportunity with 550 tickets to target people, Black, Latino, Asian. I have to say, she does not know this, but we sent out an email on Thursday night, Friday morning, to a host of people, including elected officials, informing them that we had these 550 slots available for the weekend. And we were especially concerned that they make sure that we filled them with what's now called the public facing workers, because disproportionately, that is us. A week ago today, the city opened outdoor dining. We know that most of those employees are people of color. So we wanted to make sure that they had an opportunity to be vaccinated. Councilor Mejia sent us 110 names. She set up a Google Doc. She sent it out to the barbershops, the beauty salons, the restaurants. We had 110 names from her by the middle of the day on Friday. And as of today, she's almost to 400 names. And so by far, she has probably been responsible for the drastic increase that I think you're going to see and the bump of numbers for Latino vaccinations over the weekend. I can't imagine outside of East Boston that there has been any one site that did as many as we were able to do this weekend, in large part because of her efforts. And so I want to say thank you. The stats of persistence. So a couple of things that you, as the counselors, you need to know. Black Boston COVID-19 Coalition has been fortunate in that we received not only 2 Boston Resiliency Fund grants. The first one we applied, the second one we were asked to apply because of the work that we were able to do on the first. We've been doing wellness checks. We've been doing gift cards. We've been doing food bank. We connected with the food bank, city's food bank on River Street. We hit people, we call people, we're checking on the seniors. We know where the problem spots are, Dorchester and Matapan. I happen to live in 02119. You should know that 02119 is one of the zip codes in our city where the testing is plummeting, as in Dorchester 02121. Testing is plummeting, and as well the vaccination rates for Dorchester and Matapan are lower. And you just saw that presentation by Chief Martinez. We have been targeting them over the weekend. One of the things that's happening is that while numbers are changing, the one number that hasn't changed is that 33% of the deaths from the time we started have been Black residents in Boston. And we are the only population that has never had deaths measured consistent with our 25% population in this city. The only sector. And that's alarming. We were almost 10 points over at one point at 34%. All kinds of reasons why that's the case. But the one thing that's happening now is that because we are able to connect with people, to talk with people, in the last week, I've talked, on the Lydia Lowe, Karen Chen, Lisette Lee, they literally are out on the streets, and there's no other way to do this for us. We can't wait for people to figure out how to get online to figure this out. I think that what we also are seeing now is that there's a lot of different opportunities. Harvard Street talked about this, but if people can't access it, it doesn't matter if we do 30. We already have more community health centers per capita in Boston than any other city in the country. But there have been some who have been very active, Harvard Street, Whittier, Codman Square, not only in providing vaccine, but even on the testing site. Those were our same partners doing testing. We are hoping to be able to expand the work that we're doing at BBCC and in the next few weeks. We received a very large grant from the Barth Klarman Foundation, and we are looking for clinical partners to expand. We like to be able to supplement what we're doing with the Reggie Lewis, and we also are recommending and sending people to our community locations, because not everybody, Reggie Lewis is not close if you're in Matapan or Rosendale. So we've been really focusing on the BMC and the city sites, but we also know it's clear we are in need of more mobile vaccines. And we say that not just pop-up sites, but literally a van that will go and post up at Franklin Field. And we're looking for a medical partner. I'm actually going to follow up with Mr. Mclaren today because we think that that is another way to do it. Last thing I will say to you is that there isn't one way to do this right. We have a bit.ly link. We have a phone number. We have a virtual phone bank. 20 people who are sitting in their house right now as we speak, who are calling, predictive dialing. We do targeted calling. Tropical foods, for example, because their grocery store workers became eligible. We notified them. Within a matter of 24 hours, we had a list of 50 employees. 30 of them were vaccinated on Sunday, 20 on Saturday, and 20 on Sunday. And that's what we've been doing that. We also have a stationary phone bank with 25 phone bankers physically located in the gym at Reggie Lewis, which CIC is paying those folks to do that. They get paid $20, $25 an hour. Our managers, some of them are doing $40 and $50 an hour. We take this work seriously. So I get nothing. I don't have any contract with them. My goal is to make sure that as many people of color as we can find can get vaccinated. And we don't even deal with the trust and hesitancy, because we don't see our role is trying to convince people who don't want to do it to do it. It's to provide access to the people who do. And what we're learning, that is a very, very large number. You can get 400 Latinos to go online, put on a Google, the name, addresses, email addresses, and language preference is what we have. So we know if half say Spanish, that's who we have calling them. We get some dynamite Spanish speaking, Haitian Creole, Cape Verdean phone bankers, because we asked Cape Verdean Association, the Haitian Multi-Service Center, and Greater Boston Latino Network to provide them. And so there's clearly some opportunity to do better. The partnerships are working. We actually had to go through our state electeds to get special permission, so that because Baker administration was trying to force us to abandon our sign-up process, and that they wanted us to send everyone to 211. So on Thursday morning, we got the official email from our state delegation, Senator Chang Diaz, representatives from Russell Holmes were able to convince them that's not going to happen. What do you care how we get them there? Once they get there, you do the registration. So no one's shortcutting, because they still have to fill it out, but it's filled out for them with them sitting there. You can see the operation in the gym. So that said, I just want to say thank you to what you're doing. We hope to continue to be working with you in the next phase, when the whole community opens up, to make sure that our people get connected to the vaccinations. But thank you.
Thank you so much. We're turning it over to Eva Malone from Mira.
Thank you. Good morning, everyone. And thank you so much, Councillor Edward and Councillor Wu, for hosting this hearing. To the esteemed councillors in attendance, thank you so much for allowing me to be part of this discussion today. My name is Eva Malone. I am the President and CEO of Massachusetts Immigrant and Refugee Advocacy Coalition, MIRA. And I also have the privilege of co-chairing the Vaccine Equity Now Coalition, which includes more than 30 organizations committed to advancing public health, civil rights, racial justice, and immigrant rights in our state. Our coalition came together out of a shared concern with Massachusetts' inequitable rollout of the COVID-19 vaccine. Communities of colors and immigrant communities in Massachusetts have been disproportionately impacted by COVID-19 infection, hospitalization, and death rates. These inequities underscore why our vaccine rollout must be centered on those who have been most impacted by the crisis. And unfortunately, that has been the case. I want to take a moment and give a shout out to Chief Martinez and his team for the incredible work that they have done. I had the privilege of serving on the Equity Task Force, and I've seen firsthand the incredible, enormous work that the chief, the whole team, and the city of Boston has done. Statewide, that's not the case, unfortunately. White residents have received 14.7 times more doses than Black residents, 14.1 times more doses than Latinx residents, and 16.8 times more doses than Asian residents. Put another way, 29.4% of white residents have received at least one dose of the vaccine, compared to 19.5% of Black residents, 17.6% of Asian residents, and 12.1% of Latinx residents. This is why in February, the Vaccine Equity Now Coalition issued 5 demands for the administration to ensure the vaccine rollout is equitable. Those recommendations include direct 10 million to trusted community organizations for outreach and engagement in communities of color. We heard from previous colleagues, and Diane, was so wonderful to see you, and thank you so much for your work, but the communities are doing the work and they don't have the resources that they need. So our push is for $10 million to community-based groups and communities of color for engagement and outreach. Immediately implement the promised 20% additional doses for the most impacted communities. Set clear goals and benchmarks that mirror the disproportionate impact of Black, Latinx, and Asian residents, and also improve language access and cultural competence across all aspects of vaccine outreach and administration. I'm happy to say that we have seen progress since the demands were issued. For example, the governor recently announced an additional of $27.4 million in federal funding for his administration's vaccine equity initiative. However, we still have a number of concerns and unanswered questions. That's why last week, 32 organizations from our coalition sent a letter to the governor requesting an urgent meeting with him. One of our top concerns is that the Baker administration is not distributing the promised additional 20% vaccine allocation for the hardest hit communities in Massachusetts. Additionally, we need clarity on how quickly the new funding will be distributed to community and faith-based organizations, and if there will be additional investment. We are very grateful for what has been done, but as I said, still many unanswered questions and still many concerns how the gap will be closed. Of course, you know, the actions that needed to be taken at the state level, you know, show that the administration is looking into this, that the voices of the communities and, you know, Black communities, immigrant communities, and other advocates are being heard, but there is still a lot more that needs to be done at state level. I also wanted to express my deep gratitude to Mayor Kim Jenny, the new 1.5 million vaccine equity grant that was just announced, and that will be enormously helpful to community-based groups who are doing the work on the ground, who are our heroes on the ground and need to help individuals and take them for their vaccine. We are also very supportive of Councilor Wu ordinance, which strives to ensure that every neighborhood has access to community vaccination sites with flexible hours and free COVID-19 testing. The ordinance also mandates that the city make available to the public weekly reports on a number of vaccine sites, as well as information about their location, staffing hours, and demographics for those receiving the vaccine. We cannot fully address these inequities if we cannot have access to comprehensive data, which is why the provision is particularly meaningful. We urge the City Council to adopt the ordinance without delay. I also like to take this opportunity to emphasize the need for language access and cultural competency in all outreach initiatives. We need to make sure that everyone understands that the approved vaccines are safe, effective, and free, that everyone can get the vaccine when they are eligible, regardless of immigration status. There will be no immigration consequences for seeking vaccination, and that you do not need to get insurance or to show any identification cards. I think it's very important that the community groups get the resources that they need. They have, you know, to prepare the documentation and the materials that are needed, because it's key that, especially for mixed status household families, that the concerns are still real, and the fears and the anxiety of the last 4 years is still present, to make sure that they have the information that they need, they have the support that they need to go and get the vaccine. I thank you for the opportunity to be with you today, for allowing me to make these points, and also looking forward to any questions and looking forward to working with you for the months and years to come. Thank you.
And thank you for the work Mira has done for, I don't know, over 30 years. And I feel in terms of meeting the needs of many of the immigrant populations, whether it's for driver's licenses, whether it's for education equity, whether it's for language equity now in the pandemic. So I just wanted to acknowledge that work. Mira's been at the table for dealing with secure communities, everything for years.
Thank you so much.
And I think it's just and just want to acknowledge and thank also, I think she's still here, Diane Wilkerson too, for her work in amplifying all of the things as well. It's just incredibly inspiring to see people take the reins and move and grow and meeting this moment. It's 11:30 right now, and I'm happy to, if you want to go to the other aspect, which is the other ordinance and dealing with paid leave, and just read in the administration's official statement, or at least parts of it, Councilor Wu, and then we can turn over to councilors for questions and comments. I just want to make sure, since we don't have an administration on that part, we might as well just go ahead and put in Chief Handy's letter. Okay. Again, as stated, the administration sent in a letter from the CFO dated March 29th from Chief Emma Handy, and I'm going to summarize parts of it, as it's a good long letter, and it'll be made part of the record on the administration's kind of official stance, or at least their thoughts on the leave policy. And so she thanks us initially for the invitation to testify. And she just wants to note that the city of Boston provides generous benefits already to employees, including sick leave that can be used to cover time off needed for medical events such as illness, hospitalization, vaccine administration, and even recovery from vaccine side effects. However, given the unprecedented public health emergency presented since March 20, the city has made several temporary modifications and additions. In March, the city temporarily modified provisions of the city's existing attendance policy to allow employees, more flexibility to use leave types other than earned sick time to cover illness-related leaves. They also, in March, the city prioritized services and made adjustments to employees' workplace assignments, allowing some employees to work remotely. When doing so, would be better to protect their safety. In April, the city implemented the Federal Families First Coronavirus Response Act, which by its terms applies to employees not designated as healthcare providers or emergency responders, and the city is able to grant eligible employees 2 new critical benefits: up to 2 weeks or 80 hours of leave when needed to quarantine, and up to 12 weeks of emergency family medical leave when needed to care for children due to closure. In September, the city amended the leave granted under the Families First Coronavirus Response Act and the City of Boston's Coronavirus Supplemental Paid Leave Act, and ensured that employees were allowed to take intermittent leave or reduced schedule as necessary to accommodate their children's schools operating remotely. In October, to encourage frequent COVID testing, the city created a new paid leave benefit, providing our employees 1 hour of leave during a workday and making that leave available to any worker once every 14 days. In December, we adopted the optional timing extension of, again, the the Families First Coronavirus Response Act, extending them from December 31st to March 31st, 2021. The city of Boston extended those provisions without benefit to federal tax credits offered to private employers. In March of 2021, the city again expanded the benefits available to employees. We added a new paid leave benefit for vaccination administration. The new paid leave provides that employees may take 1 hour of paid time off for vaccination appointment twice within a 40-day period for a 2-dose vaccination at time intervals recommended by the vaccination manufacturer. And currently, the city is reviewing the terms of the recently passed American Rescue Act and pending state legislation for the purpose of ensuring the city's COVID-19 benefits are as comprehensive as the law allows and helpful to our workforce as we can make them. So the details for the policy modifications and additions have been shared with city staff and are continually available at hub.boston.gov/COVID-19-forms-and documents. And the city of Boston remains committed to doing all that the city can to continue to support employees during this unprecedented times. We appreciate the opportunity to share this information. Thank you for your partnership. Sincerely, Emma Handy, Chief of Administration and Finance. So I think what I'd like to do in the time that we have is to really focus on docket 0261 and the equitable standards that ordinance would create for the distribution of the vaccines. In terms of the expanding paid sick leave, I think that we could wait to make sure that the goals of this ordinance marries with and is catching up and working with what the city is also doing to expand certain leave policies. So if it's okay, we might leave that for both dockets will go to a working session, but I wanted to kind of just focus on 0261 right now and leave 0303 for the working session. Counselor, is that okay? All right. So for my colleagues, we're going to go back and look at the equitable distribution ordinance for the remaining half hour, 45 minutes, I'll say, because I did start us late. And we're going to focus on that. I assume, Chief Martinez, you're here to answer any questions for the remaining 45 minutes?
I have a hard stop at 12:10, but yeah, I can be here.
Thank you so much. All right, then. So we're going to go in order, starting with the lead sponsor, Councilor Wu.
Thank you very much. Thank you so much to everyone for all of your incredibly thoughtful and informative presentations. I'll just list out a couple questions for whomever feels moved to chime in. And thank you again. I know some folks have been with us a very long time already this morning. So one, just thinking through the interaction between vaccinations and testing, especially in what the senator had been saying, and in what Professor Lipsitch early on had been talking about just in terms of variants. So how are we thinking about how long the testing program needs to be phased out even after vaccination gets to a certain place and by community and all that? So we'd love to hear about that. And then the other big piece I want to hear about is walk-in appointments, right? So we know that, for example, in Philadelphia, they've seen huge success in setting aside half of the appointments for walk-in residents from most impacted communities. And so are we getting to that point, that would remove the ultimate barrier in some ways of all the pre-registration and all that needing to happen. So love, particularly on those two fronts, any insights?
Sure, so I can jump in to answer the two questions that you have from my perspective, Councilor Wu. In terms of the testing program, the city plans to continue to support its testing protocol and the efforts that it's funded throughout the city for many more months. I mean, the goal for us would be to continue to have testing at the rate that we have it now, likely until the end of the summer, or connected to a vaccination rate of, getting into the 50-60% of Bostonians having been fully vaccinated. You're already seeing hospitals lay out that they're seeing a lower demand in testing as they've been able to vaccinate so many of their employees, right? So you start to see that sort of waiver. But right now, as we said, we have less than not even 19% of people vaccinated. So we need to have testing widespread. One challenge to testing, and Stan can probably speak to this, I think you sort of already did, Stan, many of our health centers who've done tremendous work around testing, the capacity for them to both test and do all the vaccination is a challenge. And so we've been working with some of them to be able to do that and also find other partners who might be able to just focus on that testing piece. So for us, we plan to do both. And I know health centers want to make that routinely available as well. And then the only other piece I would lift up is related to the registration. There are some locations that are, doing set aside slots for walk-ins for people to just come in and who are eligible. I think the fact that not everybody is eligible makes walk-ins very difficult to do right now. I think once full eligibility comes, the state will have its rules and restrictions based on any doses it provides. It doesn't mean that there might not be the ability to do that. But I agree with you, Councilor. I think Senator Wilkerson and I have talked about this many times. Can we eliminate all the barriers for people to getting in? And one of them is the need to have to do it. I don't want to underplay. Clinical partners will tell you the Moderna and the Pfizer vaccine are sensitive, I guess is the question what I would raise, and having the ability to have storage and have the right number of vials and making sure you don't waste is a critical part of that. But you're right, the walk-up piece is important.
I guess the only thing I'd add is that we are one of the partners that's with the Boston Public Health Commission, so we're doing a lot of mobile testing still. The issue we have is we are having folks show up and the demand isn't there. And we have to balance trying to make sure we have the resources to administer the vaccine with the testing, and we're seeing a decline in demand for the testing. So that's kind of just weighs on the resources and trying to figure out the logistics of it all. I think, in the background, logistics has been a killer through this whole thing. We have been pivoting since this pandemic began. We've been pivoting to telemedicine. We've been pivoting to retrofitting our space, to not allowing folks in, then to figuring out we got to get our patients in and trying to get up with a strategy to get to see our patients because we have some of the most vulnerable populations that have conditions they need to be seen. So walking, as far as the walk-in is concerned, we hope to get to that point. Access to vaccine dictates that as well as the phasing. So as that point arrives, I think the level of outreach that we're currently doing is going to be extremely helpful as that part starts to pop up.
Counselor, if I can.
Go ahead.
Yeah, just want to say, I think one of the things that is not always recognized, which Stan just mentioned, is the level of course correcting and redirecting and switching that's gone on. It's been incredible, especially since we live, particularly in medicine, in a pretty staid, and change resistant process. So one of the reasons that we are convinced that the testing is waning is because we stopped talking about it. And so that's on us. So the messaging has to be that a vaccination doesn't mean no longer need for testing. And so I know that the BBCC is working on a rollout of a major new series of PSA campaigns as we head down this stretch, which is going to include testing in it. And so we just have to be mindful of that. One of the reasons why it's waning is people think that if they get a vaccine, they don't need to get tested anymore. And so it's as much a messaging issue as a demand. We create the demand, and if we don't create the demand by education, it's going to continue to go down.
Thank you. My last question was for Chief Martinez in particular. Do you think that by the time we are at that April 19th wide eligibility date, that the city basically will have implemented the pieces we've been talking? I mean, it sounds like it's already mostly there in terms of geographic access, thinking about time of day access. Are there pieces that you feel like everything is going to basically be there by the time everybody is eligible?
Yeah, I mean, I think we're working towards, it's really about doses, right? So eligibility is one thing, but the availability of doses has to match that. So we know it's coming. Unfortunately, there will be a time when we have more doses than we have arms that want them. That is going to happen. And so I think that's important. The one thing based on some of the things that we've talked about or that I've seen, not every zip code, I would argue, needs a vaccination site. That would be one thing that the city likely isn't headed towards, primarily because what we want to do is create a lot of access in those zip codes that have been hardest hit. And so not every zip code has been impacted the same. And to give you a sense of that, some zip codes, people have the ability to figure out how to navigate these systems and to get to places and locations. So that's the only thing that I don't think we're headed towards. It doesn't mean, right now we have over 22 sites. It doesn't mean we're not going to have more sites, more pop-up clinics, and more, access. That's the only piece that I just want to make sure was clear.
Yeah, and I mean, I guess what I've learned in so many of the threads of testimony today, I think connecting what Senator Wilkerson was just saying about the importance of how we talk about it, the messaging, with what Stan was saying earlier about importance of proximity in neighborhood, and the fact that you were there, you were right there and have been there, that it makes a difference then in those moments for bringing people in and making that connection. So yeah, certainly I think it was oriented to make sure that we're combining that proximity in hardest hit areas, and to push for that to be the driving force of it. I think that, the component about, can we really link together the messaging by ensuring that there is, if not outright offering testing or talking about testing at each of these vaccination sites as well, just that they're sort of still very much linked in people's minds, and the chance to have that in neighborhood and connected, I think, is also really important. Thank you so much, everyone.
Thank you. I think Counselor Flynn may have had to jump, and I know Counselor Braden did as well. Is Counselor Bach? She may have, okay. And Counselor Campbell. So Counselor Mejia, Counselor Mejia, then Counselor Flaherty, then myself.
Yes, thank you. I'm so encouraged by all the work that our community partners are doing on the ground. Like, seriously, I can sleep at night knowing who's at the helm, making things happen. And to hear that so many people leaned into it and actually trusted the process, because again, it goes back to who is the one disseminating the information, is just such a great strategy. And so Senator Wilkinson, I really do appreciate you creating an opportunity for us to be able to do just that. So just like, that is the type of work when we think about community engagement and outreach. I mean, like, I'm like, wow. So yes, kudos to you. And Harvard Street, yes, Mr. Mclaren, like, I love the idea that you just rolled up to a barbershop. You know that barbershops and hair salons are definitely deeply in my heart. And so the fact that you all were able to do that again, it goes to show in terms of innovative strategies, just meeting literally people where they're at. And I think that if we're talking about access and opportunity, I think more of those, scenarios we need to see more of. And I think that it may be one of those things that on site and day of registration. I mean, I think that if you guys were able to do something like that, where you just rolled up at a barbershop, maybe we can look at how that looks and create more of those opportunities for right now in the moment, get your shot. So I think that, that is something else to consider. So great work on all that front. And the Boston Public Health Commission, Chief Martinez, thank you to you and your team for supporting these initiatives. Really encouraged by all the hard work that your team is doing. So just a few questions. Could you talk, Chief Martinez, can you talk a little bit about what community-based organizations you've been working with? I know we have a few, what plan to expand outreach and partnerships with the community. I'm thinking about the smaller grassroots mom and pop. Some of them are literally no names, are doing great work. So I'm just curious what efforts are being made to support some of those organizations.
Yeah, so Counselor, we have continued to partner with organizations, primarily who are funded through the Boston Resiliency Fund, who are basically coalitions of organizations, right? So there are immigrant service providers who, whether it's Alpha, whether it's the Brazilian Worker Center, the Black Boston COVID Coalition, and the array of organizations that are underneath it, the Greater Boston Latino Network, and the organizations that are connected to it. So we've been able to partner with some coalitions and then direct service providers who are doing work on the ground. And then those folks who are, a couple folks that are working in neighborhood associations and those who are trying to do initiatives through unions. So the Resiliency Fund funded a bunch of organizations. The Boston Public Health Commission funded a bunch of different organizations. The Vaccine Equity Fund that Mayor Janey just announced is intended to also provide an additional layer of funding. And what we're trying to do, and this speaks to something the Senator said earlier, we're trying to provide the flexibility for organizations to implement a strategy that works for them with the organizations they're partnering with. So if we don't want to tell grassroots groups, you have to do it this way. We do want to make sure we're delivering, which is important. We want to make sure we're translating effort into getting shots into people's arms. But that has been an ongoing effort to try to provide resources to those organizations. So the Resiliency Fund, BPHC together, I think they have funded roughly 70 different organizations on the ground to do some layer of work. And that will continue with this next round of grants.
Great, great. And I have a quick question. Thank you for that. At the Reggie Lewis Center, having done a quick little pop-up, you even feed folks and you're partnering up with local restaurants to help, get people fed. And I think that that's also incredibly helpful in terms of just the work. And I do believe that we don't have enough resources to do everything that is needed to get people in there. So I'm just curious, how can we make this process continue throughout all of our vaccine sites? I mean, I know you guys have created such a great model for what it looks like. So let's say, for instance, if we wanted to expand the work into other parts of the city, Senator Wilkerson, can you talk a little bit about what that would look like?
Before you go, Senator, just want to note that this, Councilor Mejia, this will just, after the senator ends, we're going to have to go to the other 3 more counselors. And I'm trying to make sure that, and Senator, give time for the other counselors to also get to Chief Martinez as he has a hard stop. So
And I can wait to answer I'm going to be here. So if that's okay with Counselor, please, because I want to make sure that they take full advantage of the chief.
Yep, I can wait. I can wait. Go ahead, Senator, excuse me, Counselor.
Thank you so much. Thank you. I apologize. I just saw the time and I realized, oh no, I know the chief has got to go. So Counselor Cameron, I see you've come, you're here, and Counselor Flaherty, and then myself still had questions. So if it's okay for those, all of us, if we can make sure our questions are kind of for the chief, if you have something for him, that way we can prioritize and he can go. Counselor Campbell, are you available?
Yes, sorry, I'm going between my phone and my laptop, having major Zoom issues. Not good, but we're blessed. So first of all, thank you, Chief. Thank you to all of the panelists. I know how busy you guys are, so to continue to come up and give it to these hearings and give us updates is really helpful. Really appreciate you guys' work in the community. Stan, it's so great to see you, the work you're doing in District 4, just beyond grateful to you, your board, your staff. And Senator, thank you for always engaging us. Just one, I guess maybe one question for the chief before you have to go. Actually, before I even ask my question, I also want to thank you all for the intentionality on connecting all communities of color, particularly our Asian constituents. Based on what we just recently saw and what we learned at the last vaccination hearing, this was of a major concern. We're all in this together. So the intentionality from all of you is remarkable, and just wanted to celebrate that and thank you for that. Chief, obviously with the Matapan numbers, as a resident of Matapan, that's a major neighborhood in my district. Just concerned with how low the numbers are, particularly with Morningstar Baptist Church is online. I know a whole host of residents who are going and using that site, which is wonderful. Folks call us about it. We give information along with that site and all the other sites that are coming online. So what are the barriers to getting folks vaccinated, particularly in Matapan, based on those numbers? Largely a community of color, but also a lot of seniors, right? Like a West Roxbury neighborhood, Matapan is maybe the senior, Black and brown seniors, right? So I'm just curious what some of the barriers are and how we respond to change those numbers.
Yeah, it's a great question, Counselor. I think, it's one of the reasons that although right now it's focused on essential workers, we opened the site at the Galavan Community Center in Matapan, so that we knew that we wanted to make sure there was greater access down there, which is one piece. The Matapan Community Health Center obviously partnering with BMC to create access there. But again, there's been a bunch of outreach from community organizations. I do know, I'm pretty sure, or I know for sure that the Black Boston COVID Coalition has been doing outreach into Matapan as well. So I think it's really about making sure that we're just creating as much access as we can until there is widespread availability, so that, some of the eligibility things does confuse people, right? We have met folks even in our outreach who are eligible, but they're like, oh, I don't think I can get it yet, but they were 63. And so they could get it, but they didn't know they could, right? So some of it's communication, some of it's the outreach. We've also reached into the, faith-based community and the churches to try to mobilize as well. So I think what we're seeing and what we continue to hear is that people just need to have an easier connection to get an appointment. People need to make it needs to be less complicated. The information needs to come from trusted sources. So we haven't heard, much more than that. The community health center has talked about patients saying they're just not ready yet. So that we've heard, and that's been true. We know in communities of color, many people have said, that we'll wait until other people get it, right? And that's more so in some neighborhoods than in others. So I don't think there's one thing. I think we're going to continue the working and see what some of the challenges might be from the city end and create more access. But it is why we're going to keep that clinic at the Galavan as long as I can.
That's wonderful to hear. And I think it's critically important. And so anything we can do in terms of greater investments in some organizations in Matapan is essential. So anything I can do to support, really appreciate it. And then the last question, or maybe it's a comment, is on the testing piece. And I think the senator and others have spoken to this as well. There are some neighborhoods where we're seeing testing shut down. And I've been reminding folks, even with the vaccine conversation, we have to remain vigilant. Testing is still critically important. I had to get tested this weekend because of exposure or just being at various events. And so really want to see testing sites not close, but maybe expand. And so just have some concern around some testing sites that are closing in communities as well. I think it's a little early for that. So wanted to stress that point based on what I'm hearing around how difficult it is still to get tested. There's some wonderful sites, but what is it? How do we expand those sites or keep sites that are open online for testing, which is critically important too.
Thank you, Councilor.
Thank you, Councilor Edwards. I can save anything for, thank you.
Thank you, I really appreciate it. Councilor Flaherty, did you have any questions for the chief before I'll have to go?
Yes, I did. I did. I had a brief statement, but I had a question for the chief, and I had asked if he could just stay on another minute or two. So I really appreciate his time. First off, I want to commend him. He's been in the frying pan since day one, and I got to tell you, I'm in this business a long time. Not long enough, of course, heading into another cycle, but have to tell you, his attention to detail, how the work ethic, the commitment to our city, the changing dynamics of his day, and being able to keep us informed and to be accessible as he was. I got to commend him personally for that. We're lucky to have him, and we're lucky to have his commitment to our city and to our people. That said, also want to recognize that he's also in the middle of a transition from Mayor Walsh to acting Mayor Janey, and I really believe that it was the weekly updates that the chief was giving us collectively that is going to make that a smooth transition, and it's going to benefit the residents of the city. And so I just want to commend the chief for all of his great work on behalf of the city, and was hoping that we'd be through this so he could actually get a vacation at some point. But now my concern is this variant that we're seeing in the news, and didn't know whether or not the chief just wanted to touch base on the variant and what, if anything, do we need to do as a city? Starting to see it pop up in different parts of the state and in other cities. Not quite sure what we have for data on the new variant, but how do we now, as we're increasing our testing and we're increasing our vaccines, and all of a sudden now we get thrown a curveball and we now have variant we're dealing with, and what does that mean for how we prepare our residents across the city for that?
Yeah, so thank you for your words, Councilor Flaherty. I appreciate that. In terms of the variant, I mean, it's clear that we are starting to see a presence of the variant that was first identified in the UK. It's always been said that we thought that would be the dominant strain in the United States going into April, and that's still believed to be the case. I think the reality is that we haven't seen huge numbers, but again, not all samples are being tested for the variant. So of course, it's skewed in terms of what we're seeing. We do know from some of our hospital partners who are trying to test the overwhelming majority of their samples for the variant that they're seeing about 60% of the variant show up in some of those samples. And so that would give us a sense that it's probably already more widespread than we know. The reality is still the case that the efforts to protect ourselves, even related to the variant, it's the same. It's wearing a face mask, it's social distancing, it's being really clear by getting tested, to Councillor Campbell's earlier point, and it's making sure that we do all the things we need to do. But it is true, we are sort of in a race. We need to vaccinate folks and continue to vaccinate as many people as possible to protect us from that variant. But one thing I want to just stress to folks is that you may have seen that for the first time in our data that was just released, we went up to 4.2% positivity in the city. It's the first time we've been over 3 in about 6 weeks. That increase in activity is related somewhat to the variant being more infectious. It's just also related to people are just more out and about. People are more engaged in things. We've reopened some things through the state. So again, we just need to be really mindful of it. We're going to continue to track the variant data, and we'll continue to update folks, and we'll make sure counselors have the latest information. But it is a risk, and we just need to do everything we've been doing for so many months.
Thank you very much, Chief, and thanks for sticking around for a couple minutes. I know you're very busy, and so I appreciate your time. And then through the chair, obviously, just wanted to commend Stan and all of our community health centers who have been on the front line since day one as well. And Stan and I had partnered over the summer a few times. We were connecting restaurants to make sure that there was food distribution to the frontline workers who were coming in early, staying late, and dealing with some very difficult circumstances. Also worked very closely with my relationships in the Somali community, the Caribbean, Haitian, and Cape Verdean community as well, working with the local community health centers and local restaurants, trying to make a difference, or at least say thank you to the frontline workers and put a smile on their face for the long hours and long stressful hours they were dealing with as well. And then want to give a shout out to my local community health center as one of the network of community health centers. I believe that they're up to 1,500 vaccines a week with capacity to do more. So I guess the question to someone, maybe Stan, is the communication between our community. I lose you, Madam Chair.
I still have some questions for the chief, and I wanted to get to him. So we were going to reserve all other questions for other panelists.
Okay. My apologies, Madam Chair.
No problem. We will get to a question was proposed to Senator Wilkerson and to Stan, but I wanted to make sure if it's okay, I can get through my questions real quick to the chief before he goes. Okay, I think I'm the last counselor to go, so I wanted to make sure I had just some thoughts about the ordinance in and of itself. And I think some of it you kind of noted that the city's already doing or already committed to, and some parts you're less inclined to commit the city to. So I just want to go through it. So I see about 8 components to this ordinance. So the one, and I'll just list them, and then we'll, one, we have zip code distribution, or just minimum site distribution by zip code. Then we have prioritizing impacted communities. We have the testing be part of this, continue to be part of this conversation, that the testing and the vaccination should be free, that we have at least one of the sites be available throughout the week and weekends, maybe even 24/7, I don't know, but at least one of the sites within the zip code be at a higher capacity, that there be an online dashboard that allows for streamlining for appointments for the entire city, and you can also see the entire city at one time, and then also an online portal for volunteering, so that if I wanted to volunteer all over the city and help out, I could. And then finally, the weekly reports. So that's what's in the ordinance so far. And I heard in earlier testimony, the zip code may not be I wouldn't say that the city wasn't committed to it so much as this because it's a minimum, right? It's a minimum. I think you probably do it anyway, but of the things listed, there's some things you guys are already working on and doing, right? And so let's just make sure we'll start from the weekly reports you just said you're going to be doing, okay? The 2 online portals, the volunteer one and the scheduling. What is the city?
So currently, people want to volunteer, they have to go to the Medical Reserve Corps, and that's already the ability to do that. To volunteer, you have to pass a background check, and so that's a process that's streamlined. But health centers already are using that for people, so we can make that available. There's no question for people to be able to volunteer.
Okay.
On the online dashboard, we couldn't commit to that in terms of one registration system. Some health centers have people call directly the health center, which is great. Some of them are not relying on online tools. Some organizations that do pop-up clinics, they register people at their doors and they don't want people calling or going online. So we, right now the city has one site where if people want to put their information on there, we populate it with daily clinics, we populate it with how to register. But the one portal, it's not one size fits all, to be frank. So we wouldn't, I would not want to say to health centers, you have to use this system to vaccinate in Boston. So we wouldn't want to do that.
So, and then just to be clear, it would be a single online interface for vaccination appointment scheduling that allows residents to view all available appointments at all vaccination sites at the same time. Is there any way, for example, that I could do that now?
So right now, if you go to boston.gov, I don't know the exact address, but if you do boston.gov vaccine, you can go in and see what the sites are, where they're located, and how to register. You cannot see availability of appointments because again, some of them do not do that through an online system. And many of the pop-up sites don't do any pre-registration online or by phone, they do them in person. You could see that it's coming, but you wouldn't be able to figure out whether there's appointments there or not. Because again, we want to give people the flexibility, and not only want to, we don't have any ability to tell people they have to use. See, that's what the state did. The state said, if you're going to use our doses, you have to do this system this way. And we think that has not been the best way to do it. So that's not how we'd want to do it on the city.
Okay, I will just note though, that there is, for me, in order to get the testing, I've had to go through Project Beacon, which actually then, when you go through them, they list all the sites and the available appointments at once. Like this is available here in Revere, all the way to Framingham, and they'll show it. And so I would hope that we could at least come up with some sort of citywide system that at least shows that. So moving on, then that at least one of the sites in the zip codes or in the mini districts be available on weekends, every single day of the week.
Yeah, so that's our goal. Our goal is to make sure that that's the case. I mean, the health centers are the ones that are doing a big bulk of that work. And many of them are, again, staffing is a challenge that we've heard from almost all of our health centers, the ability for them to vaccinate on Sundays or for them to vaccinate at night, which is why we're going to try to put financial resources to help folks to be able to do that. But yeah, it's our goal to do non-traditional hours and weekend hours also with some of the vaccination sites that are in the city.
Any drive-through thoughts of a drive-through?
So there isn't as of yet. We've had a couple of clinical providers look at drive-in sites, and the complication of it, and they've been able to do it in other cities across the country. The complication is that people need to wait. If you've been vaccinated on this call, you'll know you have to wait 50 or 30 minutes depending on your own medical history. And to be able to have cars come in, get vaccinated, and then sit and wait for 15 or 30 minutes and be monitored from car to car. So some clinical partners have looked into it. We have not yet had a clinical partner say they want to do that. And that's the main thing, to be able to do that. So as of right now, we don't have a plan for it, but we're open to it if a clinical partner wants to do it.
Okay, I'm sure the city already has this, but the testing and the vaccination would continue to be free.
Yes. Mm-hmm.
And regardless of immigration status.
Exactly, 100%.
And then the testing in and of itself, I would assume the city is going to be committed to testing well beyond the 90% vaccination rate. We're going to continue to test, I assume, because variants change, and we need to make sure that we're out of this completely, right?
Yeah, so testing should become routine at some level, and I will argue it will become routine, as will the vaccination process. But I want to stress testing availability, and I know Councilor Cameron, I'm not sure she's on, but when she raised the issue about testing access, Stan said it pretty clearly. It's not that the access isn't there, but when people go and create the access and then people aren't taking advantage of it, it's hard for health centers to keep doing it when they have other needs in terms of staffing. So our goal is to keep it going and keep it accessible across the city for as long as we need to.
And then, of course, the city, I think, is prioritizing impacted populations already. You showed that in your numbers. And then the final part was about the zip code. And I wasn't clear, you weren't committed to having a testing site per zip code?
So we're not committed to having a vaccination site in every zip code.
You're not.
No, because we really want to prioritize zip codes that have been hardest hit and disproportionately impacted. So we have many zip codes who that's not the case, that people have been able to get vaccinated, who are able to use the means that they have to go to a location to get vaccinated that might be in the next zip code. So the city would hate to focus on the every single zip code when we know that not every single zip code's been impacted the way that others have been. So we're really focused on the disproportionately impacted zip codes to make sure that they have many places to get vaccinated.
I assumed when I thought of zip code, I thought it was the minimum, right? So that you could still prioritize disproportionately impacted populations, just have more in those zip codes, and at least have one in every one.
Yeah, I mean, absolutely. I understand that piece, Counselor. I think what I'm trying to stress is that when we're trying to prioritize limited doses and limited infrastructure, we've really got to prioritize the zip codes that are overwhelmingly in communities that have been hardest hit. So if we really focused on other zip codes, we could, if we wanted to ensure every zip code had a vaccination site. But in terms of the strategy, that's not the strategy that I'm pushing for us to follow, which is really focusing on those other locations. To give you an example of that, the highest vaccinated neighborhood currently is West Roxbury, and it does not have a vaccination site in West Roxbury. So it's an example where you don't really need to put a vaccination site in a zip code to make it accessible. In some neighborhoods you do, but not in every neighborhood.
So would it be possible to have the two narratives, as in you prioritize your vaccination sites and those who are disproportionately impacted right now, but by the certain, I don't know, June or whatever, every zip code has a vaccination site?
So I hear what you're saying. I wouldn't, from the city's end, it's not something that I would be comfortable committing to. It doesn't mean that we're not trying to figure out how to make sure there's access in all neighborhoods, right? So for example, we reached out to pharmacies who have, for example, CVS has locations in West Roxbury, and we would like them to make one of those locations a vaccination site because we think that's important. What I wouldn't want us to do is for us to be prioritizing infrastructure, money, and doses into a neighborhood that doesn't need our help to be able to do that. So I don't think it has to be either or, but with the limited resources and limited sort of capacity, I'm trying to focus on those hardest hit neighborhoods.
Yeah, and I think the language actually is pretty open to exactly how you described, because it isn't committing infrastructure. It just basically says that at least one vaccination site operates. So if you're reaching out to, say, those CVSs in West Roxbury and saying, are you going to commit to at least, one of you being a vaccination site that operates? I understand the city saying we can't, because we are prioritizing other populations, and rightfully so. Our money, our infrastructure from the city won't be going there, but we can say there is going to be, and we're going to coordinate to make sure that there's at least a vaccination site operating at the CVS in this zip code.
Yeah. So
I guess I'm not. Yeah. Convinced that the city can at least do that.
Yeah, so Counselor, I would still disagree with that. I think the language as I read it made it that the city's effort and energy should be focused on getting a vaccination site in every single zip code. And that just, to me, with limited energy, effort, and resources, that's not what I think we should do. So again, I think creating equitable access, it doesn't mean equal access in every place. And so I think for us, that doesn't make sense for the strategy. It doesn't mean that I don't want to make sure there's a site in West Roxbury or sites in Brighton, sites in Alston, and the zip codes. There's no question. It's just, I don't think that's where the city should, intentionally focus its strategy.
Right. And I'll just, again, read the language, though, to make sure that I'm reading it as to give you the wide berth that you can say that their vaccination site. So the Health Human Services Cabinet should coordinate with the Boston Public Health Commission and Boston area hospitals, healthcare providers, pharmacies, to ensure that at least one COVID-19 vaccination site operates in each residential zip code. So to me, that is not saying that therefore the city is the one that's operating it. It's more like, can you open up a map, say that we definitely got one in this zip code, we definitely got one in this code. But in terms, I see you, Councilor Wu, in terms of being able to maximize our priority, and I think this also requires a prioritization for money and so on and so forth for the vulnerable populations. That's where the city is going to do like 20 over here and so on and so forth. So But you know what, as a scrivener is just raised her hand. Why don't we turn to the lead
Sure.
sponsor? Make sure our interpretation, Chief
Sure.
and mine, are the same. Counselor Wu?
No, thank you so much. I think, yeah, I do think we're all on the same page. And I just wanted to flag that at the time this ordinance was drafted and proposed, this was a long time ago when it was Gillette and Fenway. And so the goal was through this language to guarantee, I think, where we've ended up already through
Okay.
community groups, et cetera. I do believe that at some point we're going to need to get to every zip code, right? I hear where Chief Martinez is going in terms of we don't want to sort of hamstring ourselves by getting there first versus where we need to do it in the right order. So I feel it sounds like we will arrive at where I was initially intending this to go. Yeah, so happy to work on this language and follow up in working session.
Very well. So thank you, Chief, so much. I know that we are past your hard stop. So you've been more than generous with your time. We'll see you at the working session, and maybe by then, a lot of this may be not obsolete, but can be changed because we might be at a whole different level. I will say this to everybody. I'd like to try and get the working session before April 19th. I think we're all looking at that drop down deadline as in terms of like when it opens up massively. So I'd love for all of us to be speaking on the same page with the same standards, with the same goals, and moving forward on this. So I just want to again thank you so much for your leadership, Chief, and thank you for staying. And I apologize for not coordinating with your coming in at 10:45. I apologize for that.
No worries. Thank you, Counselor. Thank you, everyone.
Thank you. Okay, so Counselor, I think we were with Senator Wilkerson, and I'll just let folks know we do have, apparently there's another hearing coming in after us. So I'm going to try my best to make sure we don't go over 12:40, so that gives central staff some time to breathe. We're at 12:15 right now. That gives central staff some time to breathe, to focus. There's a question pending for Senator Wilkerson, and then Stan, you also had a question proposed to you from Counselor Flaherty. So just making sure that those two get priority, and then I'll go through and finish with the counselors if they had other questions for everybody. Senator.
I'm going to talk fast. One, talking with the community health centers over the last several months, even in the process of the transition from testing to vaccination. First, you should know, no surprise, that the community health centers were hit themselves. Many of the employees who got COVID or had family with COVID. And so that clearly impacted their ability to do even the on-site, never mind the mobile operation. And then the second is that with all of the focus, which means the resources transitioning to vaccine and not testing, that the same staff who was doing testing now is involved in the vaccinations. So on the community health center level, that's what we're dealing with, right? The other is that what Chief Martinez was saying, and I always, I didn't say it today, and I probably just missed it. Sometimes to treat people equitably, you have to treat people different. So what is clear is that there is not a problem with West Roxbury, white folks, bottom line, across the Commonwealth. If you go right now, this is what I tell, if you go right now to the Walgreens and Blue Hill and Quincy, you're going to see two lines. If you go to the one Eggleston Square, you're going to see two lines. One is the pharmacy for the people who live in the community, and that's where they get their medicine. The other is going to be the vaccine line. They could not be more different than night or day. And again, go back to what I said at the beginning, is that the beginning of this process starts with your ability to access online. You just had a professor, from Harvard, Dr. I think he's gone, Lipschitz, tell you how difficult it was for him, but a couple of hours. So it doesn't work for our folks. They are not having problem accessing. That's why we had to do a Reggie Lewis and all those community sites. And so just be mindful of that the resources are necessary. If they don't have them, they are making choices, unfortunately. And I think that that's why some of the testing is suffered. The second thing I just want to say about Matapan and Hyde Park is that what we're seeing right now is the same thing we saw this summer that some of you were involved in. Councilor Mejia, Councilor Campbell, I'm sorry that she left, that they have two things: disproportionately high number of multi-generational households, and second, a disproportionately high number of Caribbean households. who have been resistant, They were resistant to the testing and resistant to the vaccination because, of course, they didn't even believe the testing was necessary. And so even as the communities around them, the zip codes around them, like Grove Hall is fine, it was doing better than the residential part, the homeowners. And so the Gallivan is going to be helpful for the folks who live there, but it's the homeowners in Matapan, the Caribbean families, where we are seeing the resistance. Like I said, they were the same ones that Rep. Holmes, Councilor Mejia, Councilor Campbell had to like dispatch people in the middle of the night because they did raging parties all summer. And so that's some of the reality. So part of what we're doing, we got to match it with them. So we have the Caribbean American Carnival Association working with us. We have the Haitian Baptist, Arthur Almeida, Father Sakiki are working with us because they are the ones that are on the ground and can, communicate and touch that population. Because it's almost like counterintuitive. It's not the low income population that we're dealing with in Matapan, or even the seniors, because we go at the seniors. It's that middle, the folks who are living in the house with grandma and, who have not been receptive to the testing or the vaccination. But we're on it. And any other ideas? I just wanted to add that because Councilor Campbell asked about it, but what we are seeing it, we've been seeing it since the summer.
Thank you so much. And I agree. I think it's treating everyone equitable doesn't mean you have to do everything the same. I think you are completely correct. And I stand not so much corrected, but at least better informed, as Councilor Wu did remind us when she introduced it. We were not having these conversations. The vaccination site hadn't been opened up at the Reggie Lewis Center. We did not have a lot of these good equitable infrastructure already going. So I think I'm excited that hopefully we may not need ultimately a massive ordinance. We might be meeting these standards, or the ordinance that we do provide is really about making a lot of the good things permanent. Stan, you were also up next. I think Councilor Flaherty was asking you specifically about any things the council could be doing to help community health centers. And I think you had talked about it before you come on, and you talked about specifically how we can go where we can show up and we can amplify. But I don't know if you wanted to add to your previous comments.
What I want to do also is thank him, because when we were going through this in the beginning, he was one of the first ones to reach out to us and, facilitated restaurants providing lunch for our staff, and that was really appreciated. So I want to say something about that. I also want to highlight something that the senator just spoke to and gave great examples about, was the importance of getting trusted entities to help with regards to the hesitancy. That's been our approach since the beginning of this, and I think it's going to have to be the approach as we get further along in this, and you'll find that residents, are more resistant to getting vaccinated. So I just wanted to highlight those couple of things. I think leveraging the relationships that the counselors have, because you all have, I would say you all have been doing quite a bit of outreach just in your election process. You've touched various areas of the community. Where some of the gatekeepers and everything else. I think the example of the councilwoman Mejia, who was able to get listings to Senator Wilkinson's group. I think that's an example that I mentioned earlier, just leveraging your relationships, allowing us to go into various neighborhoods, making sure that you're part of the solution with regards to communicating where sites are. Understanding our issues around logistics is important. Also, know that offering the issue around testing and us trying to balance the vaccination, knowing that it's a race to get the vaccine in arms, that helping in messaging, I think is extremely important. So I think those things, for me, is mainly leveraging the relationships that you guys have. Space, helping us get space in the community. Space has been a real issue, especially when we're doing the testing, because you have to have a certain amount of spacing with folks, and you still have to have that spacing. And the fact that we have to monitor folks after they get a shot for about 15 to 30 minutes, space has always been is an issue. So those are the areas I think we could use help with. One thing I do want to highlight that hasn't been brought up, that we have found that we've been dealing with, especially with the Hispanic and Caribbean communities, is literacy. We have had some serious issues with literacy. We've had staff that have had to, recognize and handle that in a delicate manner, because folks are not necessarily communicating that, but there has been a level of illiteracy, health illiteracy, and that has impacted folks. You think it's hesitancy when it might not be. So, and having our staff that kind of looks like them, speak like them, and have had years of relationship with them has been helpful in kind of getting through that. So yeah, I just want to highlight that.
Thank you. I think, again, I want to just appreciate your leadership, specifically in this area, and how it really does what we've seen. And if we had operated trying to take the village from the ground up to heal a community, we wouldn't be having a lot of these conversations. But I'm going to go and check in again. Councilor Mejia, was your question answered? I know that I had to cut you off earlier, and then I'm going to just go back to if Councilor Campbell or Flaherty had anything to follow up as well with the other panelists.
No, I wanted to I think so. I think my answers were addressed. I do think that Stan's point in terms of literacy, as you all know, I've been really going hard on the fact that not a lot of people know how to read and write, even in their own native language. And that there's a privilege that we all have when we can do so. And so I think that it's important, as we continue to talk about the ordinance, how do we utilize symbols and videos and audio files as a way to engage with folks, and even putting the flag of their country so that they click it, and then there's a video that pops up that, just because I think we need to do a better job on that literacy front. And you guys know that I that's one of the things that I've been going hard on. The city government literacy piece, I think, could be the deciding factor. In fact, there were some folks that we were helping with this form. I mean, I think there's also a level of stigma and embarrassment that some people don't know how to read. With WhatsApp, they just do voice clips because that's the easiest way to communicate for people who don't know how to read. So I how we can utilize WhatsApp also as a tool for engagement and to helping people. And my internet is unstable, so I'm gonna be quiet and think.
Thank you. I'm just checking. It looks like Councilor Campbell, Councilor Flaherty are no longer on. Councilor, I'm going to go back to you, Councilor Wu, if you had any more comments or questions.
Good, thank you.
Councilor Wu is good. I think in terms of anything, so my only, first of all, of course, I echo the thanks to both the Senator and Stan, and to Mira, as I said before, while Eva was on here. I think if anything, I'd love to talk at one point about permanent infrastructure and community outreach for emergencies generally. I think there's the same thing I said to the school department. One of the issues, they couldn't adjust fast enough to allow for us to find different sites to educate kids if we wanted to have in-person learning for a special, we didn't look at the hockey rinks, we didn't look at our pilot relationships with larger universities. And I feel like I understand we're trying to build a bike and ride it at the same time, but at some point we will have something. How do we make it permanent, and how do we have a spring into, like, okay, good, something's been declared, emergencies have been declared, there's a health crisis, there's a such and such crisis, there's a blah, blah, blah crisis. What is the outreach infrastructure that's multilingual, culturally sensitive? Who are the point people? Who are the organizations who know code red? we're good to go. We have the listservs, we have the emails, we have the barbershops, we have all these different things, the churches, all ready to go, and that we move on that. So I think that if anything, I'd love for us to continue this conversation about what does permanent grassroots outreach infrastructure look like? How much does it cost? Let's be real, put a dollar sign. And I think one of the best things I've learned from you, Senator, is pay people. We don't assume everyone's going to spring to volunteer. They're trying to pay rent at the same time and
That's
also
right.
dealing with this pandemic. So
That's
I think I'd love to see that. So that's my concluding remarks. I'd love to see this become permanent. Thank you so much, Councilor Wu, for your leadership on this. And if anything, I guess I'll close out now at 12:30, allow for central staff to have a little bit of time before we spring into our next hearing. Thank you guys all. Have a good day.